we are determined not to disenroll any clients from ADAP. So once we have a client on ADAP, it's our mission to keep them on ADAP and serve them through ADAP for as long as they need to be on ADAP. So making those projections, determining sustainability, determining how many clients we can enroll really is a difficult process.
The biggest challenge has been responding to the fluctuating funding. It's so hard to project. You can do projections out 2-3 years, but then all of a sudden you take a big decrease in funding and it's all for naught. That's been the challenge. We do the best we can to bob and weave as the funding sources change, and do our projections based on sort of known for this year.
One of the greatest challenges I think that we face in the ADAP world is helping people understand the complexity of our program and to understand the facets of it does to the facets that are involved in serving the client population that we serve, and that it's complicated, it's intricate. Trying to help individuals become insurance literate is very important, and the decisions that we make around enrollments and the decisions that we make around utilization is all impacting people at a very real life level, and it's important for the program to share that story.
The other challenge is tracking clients. The clients, especially the clients on the waiting list, we want to make sure that we know they're able to get medication, and for those that are getting medication, we try to keep track of where they're getting the medications from. And for those that aren't getting medication, we try to keep in touch with their providers and make sure that there's a reason why they're not on meds or not getting meds, or if there's something we can do to assist in getting them on meds through another program.
And our ability to actually move on a dime to change as the situations, the circumstances change in our state financially, enrollment-wise. Since my arrival, every year we have hit new historic highs for new enrollments as well as just overall utilization to our program. And our state's ability to meet that challenge and meet it without having to reach a wait list, that to me is a success.
So let me tell you about one more success. Our State Pharmaceutical Assistance Program, which is our SPAP that wraps around Medicare Part D coverage. In 2009, we ran a pilot to determine whether or not an SPAP would be a cost savings, to determine whether or not SPAP would create cost savings for us. And it was very clear early on that yes, SPAP was a cost saver for us. So after the pilot finished, we were able to do some analysis of the data. We made some changes to how we managed the SPAP. We got a new contract in, and we were able to re-implement the SPAP in March of 2011. In 2011, we saved over 60% per client served on SPAP versus what it would have cost us to serve those clients on ADAP.
Twice a year, we require our applicants to have a doctor's visit and have their CD4 viral loads checked. And they have to provide that to us. Well, we're working right now to develop an electronic exchange of that medical information that's only going to serve our clients better, because it won't be their responsibility to provide us their viral load information, their laboratory results, I should say. It's going to be an automatic medical exchange between a database that already is providing it with, that has integrity. So that, I believe, is going to be a watershed moment in our program.
There is a big reward, and we're able to save a lot of money for the program and enroll more clients in the program. I think the SPAP is one of the things that has saved us over the last 2 years. While dealing with this crisis, we've been able to generate savings and keep the doors open for new clients.
Our biggest success has been, and I mentioned it earlier, the diversifying of our ADAP portfolio and increasing the focus on, or the participation in, those sides of the program that actually generate revenue. That really, sort of changed the landscape entirely for the ADAP in South Carolina.
Even more importantly, we've taken that online application and taken it to the next level in assisting my staff in electronic approvals. So as that information is coming, all determinations, assessment, Medicaid checks, dispensing authorizations all go electronically, which really makes for a more efficient, well-run, transparent program. And also, I believe wholeheartedly that it's the online process and the automation of our program that has enhanced the quality of our data. That's there because it's instantaneous. That information is instantaneously merged into our database as we began to pull out our monthly reports as we're reporting back.
I have seen how people can be affected by just getting their drugs, getting their viral load under control, and their CD4 counts up. So I try to impart that to all my case managers. I try to impart that to anyone who works for me, that that is our central goal. And it's my job to worry about the budget. It's my job to make sure that I get those rebates in. I want them to continue to enroll. I want them to make sure that every West Virginian has access to their HIV meds. And I think we've done a good job at that. And because of that, I think that the program has grown, and because of the success of programs like NASTAD's ADAP Crisis Task Force, we've been able to manage so we've never had a waiting list again.